You know what you have to do before we unleash the Kraken, right? Drop your shoulder. Good. Which gives me an idea if she's ready or not. All right, so who wants to start?
Field trip is going to be this year.
I
It's going to be a fun thing. Strawberry picking.
I have
at
no
that place we met at.
the farm.
Yeah, the farm.
Yeah, that farm is awesome.
Yeah.
Our kids go to the same school, so we see each other often, actually. So you want me to start with you,
Sure.
Natalie? Okay,
Sure.
let's just...
So I'll tell you what's going on.
Sure.
Are you recording or? Okay. So a few days ago, every time like something stressful happens, I don't know why I tense up here and I end up like this, like just rigid. And I was like that when I came in, and as you can see now, I can move my head around. They did several treatments, and it was amazing.
She's back for just wellness care.
Yes.
So we did have that pain resolve.
Yes.
Are you starting to feel that shooting pain coming back,
No,
or still? Good.
It happened recently.
Okay.
So
I kind of want to
today,
stand here so you're
it
not
just
turning your
cured.
head.
Like, look, I can
Okay,
do this. I can turn my head. I was only being able to turn it this much.
Okay. And
Before,
sleeping
so
better
it's
and
like-
whatnot. Okay.
Oh yeah, the
So-
sleeping better is
All
amazing.
right. So we're gonna just start adjusting you, and then we'll move to mom. Okay.
Okay.
So we don't over complicate things. All right. So I'm very happy that you're getting great results, and everyone's different. Age is a factor. Weight, underlying factors like diabetes or osteoporosis could affect your treatment program or the state that we may define you, whether it's the prognosis, I should say, okay? But a patient might come in, same demographics, it might take a few visits. Another patient, exactly the same, we could get it better in one visit, okay? It may take 10, but we do everything we can to try to get it done as soon as possible, okay? So let's go face up.
Okay.
I'm not gonna really explain as much, but try to pay attention, okay? So we got the interns in the background just to observe because they are the future. So you gotta pay it forward. We are a teaching clinic and I love getting these interns here. It kind of puts me on my toes, gets me excited and allows me to kind of refresh in my brain terminology, diagnoses, and train of thoughts. So it's a reciprocated relationship. All right, you ready?
Yes.
Yeah? Good. Relax, good. Perfect. And relax it. This thing wants to go a little more. Good. Yep. There it is. Alrighty. Give me your hands. Second. All right. This doesn't hurt.
No.
Your breast tissue. Okay. Breathe in. All the way out. Drop shoulders back.
Oh.
Okay. So that's moving just fine.
Mm-hmm. Yeah.
All right. Breathe in. All the way out. Drop shoulders back. That was it. But
Yeah.
when that moves back and forward like it does, but it's stiff, I know when I do the axial, the Y strap adjustment, it's gonna definitely open up. Okay. Relax the hips. What's this? What is this jingle?
Shoe jingle.
Relax, good. Ooh, dang. Just check the knee here. Hold on. Gonna get the fib. Okay, didn't need to go. All right, let's go on this side for me.
That
Yeah,
way?
face
Okay.
me. All right, bottom leg straight. And perfect. You're good. You're good. Huggies, huggies. Perfect. All right. Breathe in. All the way out. Good.
Remember last time
Yeah,
it was so stiff.
but we
So
got
much better.
an audible. Okay.
This side?
Yeah. Okay. Well, you're not coming for low back pain per se, but
Yeah.
you know, I do believe the spine is connected. So if there's no contraindication, I still adjust whatever I can. That just went all of them. These have 3 joints. The thumb only has 2. So there it is. Perfect. All right. Just want to make sure I don't kick your mom. All right. Breathe in. Out. There it is. Good. Good. It's moving fine. All right. Let's go on your back. Let me actually go get the.
Okay.
So we found a nasty knot here.
That's the one.
Yeah. Can you show us where it's traveling to?
Down my arm.
All right.
And it started right here, believe
Okay.
it or not. I bent down to do something and then
Okay.
it started and then it got knotted.
Okay. So I have anterior and posterior pressure. It is a muscle belly of the upper trap or trapezius. And I'm not pushing that. It's not too firm, but you don't need to. But as it improves, I will have to push harder and harder. This muscle also can refer headaches.
Yes, which I
Alright.
had one before I got
Yeah,
here, but
so-
after the treatment,
Yeah. So
it went away.
are you a side sleeper?
Yes.
Okay. And are you sleeping on the right shoulder?
Yes. A
So-
lot. Yeah.
A lot of people will develop rotator cuff issues because if you're sleeping like this, the supraspinatus, which is the number 1 injured rotator cuff muscle, does this. I remember it by Oshok's muscle. So the way we sleep, you're literally shortening that muscle and then you're sleeping on it. I will actually I will show you a diagram so you guys could understand better. When you put your head here, then there's a tendon that goes in and out of a joint. You push that tendon and you cut off the blood supply. So if you do long lasting or long years of continuous sleeping on the shoulder, you will develop a frozen shoulder by cutting off blood supply or getting adhesive capsulitis. You will start developing calcium deposits in your shoulder, which will allow you or not allow you to have full range of motion of your shoulder. Okay. Some patients or anyone out there who has the inability, like they'll come here and they can't move the shoulder and now they have to kind of compensate using their traps to reach for something. That is likely a sign of frozen shoulder or adhesive capsulitis, which we get good results with the treatments we do here at Chiropractic. So, all right. I'm going to get Eric back in here.
Okay.
Hold on. Eric.
There he is.
There he is. What's up, buddy? Just go there. Luckily, it's fine. It's fine, buddy. I actually want to just go right in there. Is this shooting down anywhere? You want me to close the door?
Yeah, over here.
Okay. Nothing down the arm.
No.
So this is actually recreating the pain in the chest region. Okay. This whole chest thing that you spoke about reminded me of like when I was a student and I had to examine an elderly female patient who complained of heart attack symptoms, but multiple times going to the emergency room, negative EKGs, heart
And
was
it's shooting up here.
fine.
Sorry to
Yeah, no, it's fine.
interrupt you.
Okay, because I am pressing harder and harder. So obviously, if a patient presents with heart attack symptoms, you're gonna send them to the emergency room. But if this patient is adamant and has records of negative EKGs, ruled out heart attack, you kind of look further. And there is something called pectoralis angina. So it's,
Which is what I feel I have.
yeah. So did we talk about this last visit?
No,
Okay.
but the heart attack thing, I always feel like it's something with my heart, but I know it's not because it's always with this.
Yeah. So the pec minor has 3 heads. It attaches like this. Okay. It obviously goes closer to the sternum, right? So if that muscle spasms, it starts contracting the rib cage, and it's conveniently located very close to the cardiac cavity, which can start mimicking heart attack symptoms. So if anyone out there listening has had heart attack symptoms that have been ruled out or negative with exams and imaging, consult your local chiropractor. Let them examine the pec, maybe see if it's a diagnosis that, because it can be easily treated. It's just a spasm of a muscle, probably some nutritional advice and adjustments, mobilization, and some work on that pec minor. I know. So let me know in the comments if anyone's experiencing that, and if you guys do end up going somewhere, let me know the results. All right. Hopefully we change someone's life today. Other than yours, of course. Right? All right. Let's lift up the neck.
Okay.
Down.
Okay.
All right. So, I mean, I dug right in there. Okay?
Yeah.
After I'm done, can you bring me the shoulder model? Yeah. Okay. Do you know where it is? It might be in Dr. Andy's room. Okay. You ready? Mm-hmm. All right. So we advise patients, make sure you're not biting your tongue. Just clench your teeth. All right. And put your feet down, actually.
Okay.
Yeah. All right. And do you feel like you're choking?
No.
All right. So once I
Feels
stretch,
good.
Just give me a thumbs up or thumbs down for yes
Okay.
or no. Try, avoid moving your neck. All right.
Okay.
Take a deep breath in. Out. Good. Awesome. Just keep breathing. Out. Good. And I like to give it a few sets. Keep breathing. Yeah, I'm going based off you. So when the patient breathes in, the muscle relaxes, right? Or breathes in, it contracts, I'm sorry. And then you exhale, that muscle relaxes, and that's when you want to deliver your thrust. But if you've noticed, I give some tiny little test thrusts just to see how lax her tissue is, which gives me an idea if she's ready or not.
Woo.
And she was definitely not ready for the thrust, but she was ready for the thrust, if that makes sense. It was great. I got her all the way down to the low back. So
Oh yeah, I feel it.
and I need to do a better job. I'm going to start telling patients after the adjustment, just try not to get up. Let the body just kind of.
Yeah, I feel it down my.
It's beautiful.
Back. Yeah.
Okay, so you'll get the blood flow to the brain.
Thank you.
The spinal fluid flowing all over the spine, right? So we get that pump action, which I learned in SOT, which was pretty cool. The CSF, Dr. Adam Del Toro, gave us a nice course on that. Okay. Can I pull your ears today?
Sure, if you want to.
All right.
That was another thing.
Yeah. You had the vertigo.
Yeah, I had the vertigo, and literally, when you did that adjustment, that was it. Like it just instantly goes away. It's crazy.
So was it vertigo or just ringing in the
It was
ears?
vertigo.
Okay.
I had to take. My mom has vertigo, so she had pills the night before when it happened. The room was spinning. I had to take her pills.
That bad for you. I remember.
I couldn't stand. I had to call her on my cell phone and tell her to bring it. I couldn't even get out of bed to get the pills. So
your balance is through your ears. I don't want to say I treat or cure vertigo, but these tympanic membrane ear adjustments, they do work favorably with vertigo patients, or at least help decrease the symptoms to a more tolerable level. Okay, which some people will take all day. So I'm happy you have positive. Just one, right?
Or spinning, that time you did it. Yeah, it just stopped.
Good.
It stopped immediately.
That's awesome.
Thank you.
Well, I'm gonna adjust your neck seated. Yeah. Okay. And I'm still gonna pull your ears. Why not? Okay. Okay. I stand the stack, Duke. Thank you. Oh, she's getting up real good, actually.
You see that?
Yeah. You've completely earned, getting some one-on-one training. Okay. You ready?
Yes.
All right.
Yes, it's not as bad as.
It's not as, which isn't a bad thing.
The first time was crazy.
So there's 3 joints in there. Sometimes just relax. But besides the ear, we do try to target the uppers, okay? Especially C1, C2. They are very close to the ear canal or the mastoid, right? So even that can be connected with jaw pain. I've once had a middle ear infection, completely locked up my jaw, and made sense because it's all connected. The whole body is a closed chain, right? All right, we're definitely gonna get uppers on this side because it is not moving. You know what you have to do before we unleash the Kraken, right? Drop your shoulder. Good.
This really helps me sleep. I know you had mentioned.
Yeah.
Because I have chronic insomnia,
Okay.
and literally for like 2-3 weeks, I sleep like a baby.
2-3
And then
weeks.
it, starts up again, but we've only done it
Did your
once,
husband thank me? I don't know. But yes, so when these pops happen, you get a hormone release called endorphins, and I try to let my patients know. And that hormone makes you feel euphoric and relaxed.
Yes.
And some patients very locked up or big Y strap audibles or cavitations is the term we use for pops. I let them know you're probably going to knock out a few hours early and have a very good night's sleep where you're not waking up middle of the night. And that's usually the case. Okay. Yeah. One time I did tell a patient, you're going to sleep so good, you're not going to wake up. And then immediately realized that didn't sound right. And I had to correct myself. Yeah. So you ready?
Yes.
But very, very good results already. So this is what, treatment 2 or 3?
2.
Yeah.
2.
Good.
Yeah.
Not too bad.
Hurting anymore. Yeah.
All right. Okay, we got one upper here, and then I'm gonna target the lower, which if she's having trigger points and tightness here, very likely the lowers on this same side are going to be locked up. So just lean back for me because it is one where I may have to get the first rib at the same time. So just really need to lock it out. So I'm taking the trap off the tissue of my finger pads, okay? And then just locking it up. And then we just unleash the Kraken. Drop your shoulder.
It doesn't hurt.
It just
feels good, actually. It's like a full body release.
Yeah, don't turn your neck. It's okay. Well, say hi to. Well, I was gonna say hi, Mom, but she's right here. So. Good, right. Amazing.
Thank you.
Enjoy
so
the
much.
good night's sleep coming up.
Thank you. Oh, I'm gonna sit here.
Yeah, sit.
No, my friend saw me on Sunday. I was like this.
Oh yeah.
I couldn't move my head back. I was literally like this, and they're like, "Are you okay?" And they notice it's physical.
Yeah.
I could only go like this, and now it's like.
There you go.
And when I came in today, I was only able to do this.
That's
so
cool. Yeah.
No
if those joints are locked
meds,
up,
nothing. Yeah. Just natural.
Chiropractic.
Yeah.
So the body is developed or evolutionized in a way where, yes, God forbid, the very severe diagnoses, proper nutrition, proper sleep, proper physical and mental health, your body is able to cure most pain or illnesses or disease. And I know I said dis-ease is disease, right? So we just need to look in a healthy balance of everything, okay? And I'm not saying we treat and cure all things, but most people find relief with chiropractic, which unfortunately some people go straight to possibly medication and stuff like that, which to each their own. But it's not exactly. You're just numbing it. Come in, Eric.
I feel like this is the ultimate self-care when you do this for yourself.
And I would love all my patients to be a wellness patient. And, our motto now is adjust your lifestyle. So adjust your lifestyle, guys. Hope you like it. It's pretty good. I'll show you. Oh, well, since you're here, actually, you want me to go ahead and demonstrate, right? So this is right shoulder. So imagine if this is your shoulder blade, you got your clavicle, collarbone is layman's terms, okay? This muscle here is your supraspinatus. See how it goes under this joint and then comes out here. It starts from the back, ends up here, and hence why we're able to have this movement, right? So when this happens, we sleep, we put our head right on this joint, right? And then you push this joint down, cutting blood supply, causing calcium deposits, scar tissue, and then it takes over the entire space of the joint, which then doesn't allow you to get your range of motion. So we do actually treat this with the shock wave. I have a good post-isometric relaxation technique I do for frozen shoulder. And once I adjust the ribs,
Yeah.
so if the shoulder blade's here, when I have them hug, the shoulder blade comes out, exposes all the ribs underneath the shoulder blade. Once those get popped in, this could finally start moving, opening up. So, I love these things because I always try to explain in a way patients understand. The more they understand, the more they're committed and understand the process, and we get better results. Okay.